All right, now that we've gone over plaque, we're going to start going over toothbrushing, okay? So, can you tell me what is the purpose of toothbrushing and the purpose of tongue brushing?
To remove plaque and other things that are in your teeth and mouth.
Yeah, exactly. It can also help prevent tooth decay and gum disease. And as far as your tongue's concerned, it can also help reduce bad breath and from bacteria spreading to your teeth. All right, so tell me, what type of brush do you use?
I usually just get whatever toothbrush is the cheapest.
And you know what? That is perfectly fine. Not all toothbrushes have to be really expensive, like state of the art name brand toothbrushes. What really matters is the kind of toothbrush, right? So, do you know what type of toothbrush do you use? Soft, hard, medium?
I guess maybe it's medium.
Medium? Okay. So, it's generally best to use a soft bristle. Like, it doesn't take much to remove plaque from your teeth, you know? And the harder the bristles are, the more abrasion is going to happen with your teeth, and we don't want that. Okay? So, using a manual toothbrush is absolutely perfectly fine, especially if you use the right method. There have been some clinical findings that using an electrical toothbrush is better at removing plaque, and it also kind of like with the newer ones, they'll tell you if you're brushing too hard or too soft. You know, they'll even keep time for you of like how long you're brushing your teeth. But if you want to stick with a manual toothbrush, that's perfectly okay. So, can you tell me how you brush your teeth? And show me here on this Typodon. Right, getting good on those occlusal surfaces is important. Okay. All right, that's good enough. And how often do you brush your teeth a day?
Once a day.
Once a day? Okay. So there are some good things that we're doing, right? Like you're brushing your teeth at least once a day. There are some things that we can do to make that more efficient and optimize getting that plaque off. And what we recommend here at the clinic is what's called the Bass method. So instead of like scrubbing back and forth horizontally with what you were doing, where yes, that will get plaque off of your teeth that's really abrasive. So what we recommend is taking the brush, angling it up at a 45-degree angle up into that gingival margin, like your gums, right? And instead of scrubbing, we want to just do a little jiggle, right? All those ends of those bristles are just gonna get in there, right? You don't have to do it hard. You should just very gently, all right? And so 2 to 3 teeth, move on, do it again, move on, do it again. Just a couple passes each time. And then when you get to your anterior teeth, your front teeth, if this like starts getting kind of difficult to do, right? What you can do is go like this at that 45-degree angle, still with that small jiggling motion. Okay?
Mm-hmm.
All right. And how long? So you said you brush once a day. How long when you brush?
I've never timed myself brushing my teeth.
Never timed? Okay. So what we recommend is definitely kind of how we were talking earlier with the plaque, how it grows every 4 to 12 hours. Definitely want to try and start brushing twice a day, right? Once when you wake up in the morning and once when you go to bed. At least 2 minutes. No more than 3 though, because again, there's too much of a good thing. What I like to do, I like to get a small song that's 2 to 3 minutes long, jam out while I brush my teeth. You could also just time yourself with a timer, or another common way is to sing happy birthday twice. But we definitely want to try and make it at least 2 minutes long each time, okay?
Okay.
All right. And can you tell me why it's so important to brush your teeth?
To prevent all the diseases you said, like periodontitis and plaque and gingivitis.
Mm-hmm. Yeah, absolutely. All right, so that is the information that I have for you. Do you want to go ahead and tell me back some of the things that you learned today with toothbrushing?
that when I buy a toothbrush, I should look for a soft bristled brush that's ADA approved, or one of the new electric toothbrushes if I can find one or get one. Also, the Bass method of brushing rather than horizontal brush strokes.
Yeah.
And then making sure that I'm brushing my teeth twice a day for at least 2 minutes, no more than 3 minutes.
Yeah, no, that's honestly so good, and you're doing such a great job taking in all this information. And real quick before we go, can you go ahead and demonstrate that Bass method for me? Angle it up just a little bit more. There you go. Yeah. Perfect. Yeah. No, you got it. So do that twice a day, and we should definitely see those results and have those short-term goals met, you know?
Okay.
So we're going to go back over that care plan before we leave. So, have an understanding of what plaque is. We did that. Demonstrate proper brushing techniques. You just did that and you did such a good job. So we've already knocked down 2 goals. So next week when I see you, I guarantee you we will absolutely see that score down to 2.5. All right? And what we'll be going over next week is halting the progression of your periodontal disease by reducing the bleeding score to 0% by April. And some short-term goals we'll talk about is understanding what periodontitis is, reducing that bleeding score by 20% by each visit, and demonstrate proper flossing techniques. All right? Okay. See you next week, Mr. Engel. Thank you for coming in.
Thank you.